शॉक ट्रीटमेंट करके देखते हैं।
हाँ जी, कर लेते हैं। I love Govinda's comedy. This is such a great comedy. This is really far from what actually happens during ECT. The thing that is going on the head looks like what is put on the chest for an ECG. When the shock treatment is done, the brain activity has to be measured. This is done using electroencephalogram, which looks more like this, and this scene in the movie looks like a seismograph, something like what is used to record an earthquake. Boom! Here is the best part. You see, the doctor is not doing anything but just watching. Dr. Saab, kuch to kijiye. Dr. Saab looks so confused. This person in the back is messing around with something. Maybe trying to give a shock, I think.
20 साल के अपने कैरियर में मैंने ऐसा केस कभी नहीं देखा।
मैंने भी नहीं देखा।
मगर सुंदर को उसकी आवाज हटा दीजिए। मैं एक बार उसकी जुबान से अपना नाम सुनना चाहती हूँ।
Oh wow! So Govinda had shock treatment for not being able to speak. Shock treatment is given for people with severe depression and bipolar disorder.
इनकी स्पीच थेरेपी करवाते हैं।
स्पीच थेरेपी यानी?
So speech therapy makes more sense for someone who is not able to speak. This is from Jewel Thief, which possibly could be the first Bollywood movie with shock treatment. Or there might have been other movies. If you know of any, comment below. A person cannot be given more than one shock in a day. The doctor is absolutely right.
कोई आदमी ऐसे भी होते हैं जो एक शॉक से ही अपनी याददाश्त और कोई ऐसे भी होते हैं जिन्हें
The doctor is again right. So the shock treatment is medically known as electroconvulsive therapy, or short form ECT. This is given 2 to 3 times per week for a total of up to 12 treatment.
यानी 6 दिनों के अंदर तुम यकीन दिलाते हो कि विनय अपनी जिंदगी की हर बात भूल जाएगा। क्या बात करते हैं? उसे तो अपना नाम तक याद नहीं रहेगा।
Yes, so memory loss is common after shock treatment, and this could even last for up to 2 months after the treatment. If memory is a problem, then instead of using shock treatment on both sides of the head, only one side can also be used. For all those who are worried about shock treatment, the good news is this is done under anesthesia. You see, they're injecting something. It may be a pre-medication, which is a medicine given before anesthesia. Now, the shock treatment is not done forcefully like this. The patient has to give permission. Okay, so maybe this is the anesthesia. Patients are not left like this, but are given oxygen and kept safe by anesthesia doctor. So the white thing is actually a bite block. When the shock treatment is given, there is a chance that the tongue can come in between the teeth. This is placed to prevent tongue biting. It really looks a lot better than this. So that thing looks like a galvanometer that we used in school to do some experiments. I don't know if you remember using a galvanometer to check the electric current. I have no idea what this is, but maybe that's how it looked in the 1960s. As you're watching this, do comment below what do you think about this. Where did that blood come from? That blood stain with a bandage on, this does not happen unless somebody hits you with a hammer. This next clip is from the movie Yaarana with Amitabh Bachchan in this. Once again, a forceful treatment does not happen this way. That white thing is called a gauze, which is kept as a bite block. The way it is put, I don't think it is going to help. It is not done this way. What is that thing on the head? It looks like a headband with a wire on it. No anesthesia is shown here. Very incorrect way of showing a shock treatment. Okay. Patients will move out to another room on a wheelchair or a stretcher. They cannot walk so soon because of anesthesia and the tiredness with the treatment. So this one is from the movie Damini with Meenakshi Sheshadri in it. These movies keep showing the same thing with no anesthesia. I mean, these have been done again and again. They should improve at least at some point. Here it looks like multiple shock treatments are used. That's incorrect. So here is a surprising news. While I was preparing for this video, I obviously did some reading. When I went into Wikipedia, I was shocked to see shock treatment used to be done without anesthesia in China. I couldn't believe it. But now, thankfully, all shock treatments are done under anesthesia and nothing is felt during the treatment. This clip is from a movie called Raja with Sanjay Kapoor and Madhuri Dixit in it. And let's see what's going on here. This looks like an operation theater. Shock treatment is not done here. Operations are done in an operation theater, but not a shock treatment. The thing looks like a belt made of metal. Show all these weird things in the movie. If the movie makers make some research or ask around, they will find the correct way of doing these things. Now, you see this? The shock treatment is on. The hero is apparently running. So shock treatment causes fits or seizures to happen. These seizures typically last for less than 60 seconds, and this is not correctly shown here. In fact, the seizures are helpful to provide benefit. This is one of the primary reasons why shock treatment is done. Alright. So the next movie we will watch is Har Dil Jo Pyar Karega. Looks like Salman Khan, Rani Mukherjee and Preeti Zinta are in it. Oh my god. This is shown in such a horrible way. No treatment is given on a wheelchair. The patient is made to sleep, made comfortable, given anesthesia, and the others happen after that. Why is a policeman checking a patient? The doctor is quiet. The worst thing is that the policeman is saying what the treatment should be. Now, this is not real, obviously. Imagine a policeman saying what treatment needs to be given to a doctor. What would happen? In reality, if police has to talk to a patient, they get the permission of the doctor to do so. And I have seen many times the doctors and even me refusing the police to talk to the patient because the patients are very sick. They are in the ICU. They cannot speak. This is a worse dialogue. ऐसे नहीं होता. Just because this is a mental hospital does not mean people are screaming there. So looks like this movie is Woh Lamhe. Why are they trying to tie the hand and legs? This is incorrect. Are they giving a medical treatment or what are they doing? Are they giving a punishment? What is that in the mouth? That looks like an ice cream stick, doesn't it? That ice cream stick does not help. Using that can cause problems. Imagine if someone is biting on a stick and it gets cut off and then goes in the mouth. That would be painful. I have never seen something like this being done to prevent biting. Ho, ye kya ho raha hai? This is so stupid. There is no point talking about it. Well, next is Manthan Ek Kashmakash. Looks like the patient is having an MRI scan here. Maybe. Well, this is not unreasonable. If the doctor thinks there may be reasons in the brain causing symptoms, they may do a scan before, like an MRI or a CT to rule out any problems before actually getting a shock treatment. Okay. Looks like the doctor is probably talking to the patient and maybe the patient's wife. I have not watched this movie, but looks like they have done a okay job than others. This is kind of the correct way where the doctor comes and talks to the patient and the patient's family. Oh, hold on. Here is a good thing. They are giving oxygen, which is what usually happens. Anesthesia is given and the patient may need some oxygen. So the doctor is talking. So this looks like the doctor also explained what happens after the procedure. If you have any additional movies you want to watch, leave in the comments below. So this is what happened in the movie. What all I said while watching the movie clips is based on my experience. If you have a different experience, comment below. Of course, every hospital, every clinic may be different, so you may have a slightly different experience than what I told you. But the principles are the same. I have left a very useful article in the description below. Do check it out if you're interested. Click this link above to watch videos on how to improve brain health. Let me know if you have any questions and I'll get back to you as soon as possible. Thank you for watching. I hope you enjoyed this clip. Take care, stay safe, and I'll talk to you soon.